Good evening, Berkeley. I'm your Mayor, Jesse Adeguin, and thank you for joining me for this virtual town hall meeting on the City of Berkeley's response to the COVID-19 pandemic. I'm joined by our city team, our City of Berkeley Public Health Officer, Dr. Lisa Hernandez, Dr. Lisa Varhus, the Director of the Department of Health, Housing, and Community Services, and Deputy City Manager Paul Budenhagen, who will be filling in for our City Manager this evening. I want to thank you for joining us today and answering our community's questions around our COVID-19 response. And today's town hall comes on a very grim milestone. We learned today that the United States has reached the 500,000 person mortality rate. Over 500,000 people have died in the United States due to COVID-19. One of the highest death rates in the whole planet. And we know that the risk of COVID-19 still continues, even with greater access to vaccine, particularly with the potential of several variants spreading, not just in Alameda County, but throughout the state of California. And so it is really critical that we continue to take the steps to protect ourselves and protect our community to help control the spread of COVID-19. This town hall also comes close to the 1 year mark of our shelter-in-place order. And I just want to take this opportunity to not only recognize that the shelter-in-place has had a significant impact on our businesses and on our residents, and our kids, kids not being able to go back to the classrooms, although the district did recently announce that they are going to be moving towards phased reopening of our schools, but has come at a great sacrifice. But it has been really critical for us to be able to fight COVID-19. The fight is not over, and we must continue to fight this deadly virus until everyone in our community is able to get vaccinated, and we can get through this very difficult time in our city's history. So before I turn over to Dr. Lisa Hernandez, I want to take this opportunity to thank you, the people of Berkeley, for everything that you've done to get us to this point. And there is light at the end of the tunnel. But today we mourn the over 500,000 people that have died in the United States due to COVID-19. Many of these deaths were unnecessary due to the lack of an effective federal response. But I'm heartened to know that on the local level and certainly on the national level, we have leadership that has been prioritizing science, prioritizing the health and safety of our communities. And with vaccine being rolled out and more vaccine on the way, I'm hopeful for the future. So we honor those who've lost their lives, including the over 30 individuals who've succumbed due to COVID-19 in the city of Berkeley. And let us recommit ourselves to make sure that no more people die due to this deadly virus, that we can control the spread of this virus and get through this. So I want to thank you for joining us. We received many questions from Berkeley residents on a wide range of topics. We'll get to your questions, but I first want to turn the floor over to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And thank you, Dr. Hernandez, for joining us tonight. If you can provide us an update on the number of cases in Berkeley as of today, and any other relevant information you'd like to share with the Berkeley community around our COVID response.
Sure. Good evening, Mr. Mayor and residents of the City of Berkeley. I'll start with the numbers as usual. First with Alameda County, and then focusing in on the city and talking a little bit about some notable cases and outbreaks, and then go from there. So in terms of cases, this is not including City of Berkeley in terms of our cases and deaths. For Alameda County, 76,374 cases have been confirmed of COVID-19 in the county, with 1,165 deaths. And hospitalizations, which do include City of Berkeley residents, total currently hospitalized are 174 individuals currently hospitalized. That is a continued downward trend from the peak that we saw both in hospitalizations as well as ICU hospitalizations back in December, late December, early January, where we were seeing upwards of 500 individuals hospitalized at one time. For ICU, currently 55 individuals are hospitalized. For the case rate, which is the indicator that is calculated by the state for the county, Our current case rate for county-wide is 16.4 cases per 100,000 per day, which is unadjusted. And then there's an adjusted case rate that is adjusted due to testing in certain populations. It's called a health equity metric. That adjusted case rate is at 12.6 cases per 100,000 per day. And our test positivity is at 3.6% for the county. These numbers are calculated every week. So that was last week's number. We expect to see another number tomorrow in terms of both our case rate and our test positivity. And I'll talk a little bit about those in a second. For City of Berkeley, our cases now are at 3,213 cases. We're averaging about 10 cases a day. We're seeing those numbers coming down as well in terms of our cases per day. And I'll talk about our case rate in a second. Hospitalizations are at total 109 since the beginning of the pandemic. Deaths are at 35 total. And test total reported to us on City of Berkeley residents now are at 235,189, and we're averaging at about 972 tests per day, which is excellent. And our test positivity is at 1.5%. That's cumulative from the beginning of the pandemic. We calculate our own indicators because the state does it at a county level, and that's what they use for tiered status, but we do our own numbers as well. And our case rate is at 29 cases per 100,000 per day. Again, that was what was calculated last week, and that's a week lag. That's what we look at. And our test positivity is at 1.8%. When you look at our case rate, it is higher and continues to be higher than the county's case rate. And that is primarily due to cases that we're seeing at UC Berkeley. Again, this is a lag of a week. And so currently our case rate, which is also still reflecting last week's numbers, are still higher than the counties, but we're seeing a downward trend. So that is very hopeful. And I will talk a little bit more about what we're seeing at Cal in a second. So on a county level, we're seeing declines on our case rates and recovery in general from both jurisdictions from the winter surge. We're still higher than what we were trending before the holiday started, but we're seeing a definite reduction in both our case rate and our test positivity. And actually, we're seeing our test positivity in the orange tier, which is very hopeful. Our case rate is still purple, but it's getting closer to red tier. So that is also something that we're watching, and we're hoping that we as a county will be moving into the red tier in the next coming weeks. We do think that the region as a whole will be moving to red tier in the next few weeks as well. So this is very hopeful. We're progressing in the right direction, though we know again that that virus is still widespread, and we need to continue to have those rates go down, and hoping that we won't have any more surges. We're hoping that the surges continue just to be associated with holidays, and there are not any big holidays coming. And as long as people keep doing what we've been doing to slow the spread by wearing face coverings, practicing social distancing, and avoiding gatherings, that we will continue to see the case rate down. This is even more important with the variants circulating, not only in the state, but in the region. We have seen some of the variants circulating in Alameda County. We actually have two variants that have been detected here in Berkeley. They're both two cases with the UK variant, which is the variant that seems to be more contagious, but not causing more impact in terms of disease. So we are seeing some of those variants throughout the region, the state, and our jurisdiction. So at this point, We know people have to continue to be vigilant and to adhere to the recommendations. There are no changes in those recommendations based on the circulation of variant at this time. So I just want to talk quickly about UC Berkeley, and then give an update on Golden Gate Fields. That was a request from a member of the public, so I just wanted to give a brief on that. So with UC Berkeley, we continue to work with Cal on the cases and the outbreaks that are both on campus and off campus. We've seen marked improvement with the case numbers on campus, and that was due to the sequester or shelter in place that occurred for 2 weeks on campus. And because those numbers have decreased, activity is back to normal on campus, so students are able to move freely unless they are isolated because they're cases or quarantined because they're contacts, and that's what they were doing prior. And what we saw is once students were sequestered, the level of transmission was decreased. So we knew that worked, and thankful for the actions of the campus on that. We continue to work with Cal and the Greek houses on the outbreaks and the cases that we're seeing there off campus, specifically in the Greek houses. And thus far, what we've done as a city is that we've increased patrols around the UC campus with particular attention to the Greek houses, particularly during weekends. And UCPD is making resources available for joint patrols on weekends in response to a request that we've made as a city. Student government and non-Greek students are supporting the efforts off campus as well, and are working internally on campus for some support. And we're also working on a joint letter that will be released later this week to the student campus. Other things that we're doing as a city is that we issued 7 letters last week to the Greek houses with outbreaks, reminding them of their responsibilities to isolate, to quarantine, not to throw parties, and that there was additional citations that could be issued to them, just as we have civil citations for other individuals in the community. And in fact, we issued a citation last week to an individual who was found to be non-compliant. So we have stepped up some of the activity around campus on our own as a city, as well as in collaboration with UC. So I just want to give a brief update on Golden Gate Fields. As individuals, everyone may be aware, there was a large outbreak at Golden Gate Fields that actually started in November and ended, we closed the outbreak in January. So it was a very long outbreak. And I just wanted to give some highlights of that outbreak. First, we were informed about the outbreak on November 2nd by Golden Gate Fields, who let us know about multiple cases among their staff. At that time, we directed them to isolate and quarantine all the cases and isolate the cases and quarantine the contacts. And we had them also obtain testing for any of the contacts that were not tested already to determine the extent of the outbreak. And we also conducted a site visit 2 days later. Once we got the results of those tests, we realized that there were additional cases that were reported to us because individuals had gone to get tested on their own, as well as the testing that was requested by us. And there was a total of about 170 cases that were identified. And with that, we directed Golden Gate Fields to cease operations and to test all remaining staff that had not been tested. With the remaining results coming back, we had Golden Gate Fields quarantine anyone that resided on campus that did not have an efficient way to quarantine on their own, and they were given housing by Golden Gate Fields so that they were not in a congregate setting. And at that time, we had them do regular testing twice a week to test susceptible employees that were on campus still working, as well as those that were quarantined off campus. So we continued that testing until 14 days worth of no new cases. And that got us to January 23rd. Sorry, it was not the 3rd, it was the 23rd, where we had a total of over 370 cases identified during that outbreak. Other things that the Golden Gate Fields had to do was they had an updated safety plan that requires them to do surveillance testing of any individuals that were never a case. And that's similar to the testing that is required at skilled nursing facilities, where they have a rotating weekly testing of a quarter of their staff. So in a month's time, each staff is tested one time. So that is something that they continue to do while they're in operation, and while we're still at this level of COVID in the community. Due to the fact that they're a congregate living facility and they are high risk for developing cases in that setting, we have prioritized them for vaccination. So they will be vaccinated in the coming weeks as vaccine supply allows. So that's our limiting factor when it comes to vaccination of some of the high-risk communities that we have here in the city. But they have been prioritized, and again, we'll be offering them vaccine as soon as we have the supply available. So I will stop there, Mr. Mayor, and hand it back to you. And I'm sure there's lots of questions that will come during that question and answer session that I can help answer.
Thank you so much, Dr. Hernandez. I want to now turn to our acting city manager, Paul Budenhagen. If you can provide an update, Mr. Budenhagen, on city operations and any other updates you'd like to share from the city manager's office with the Berkeley community this evening.
Thank you, Mr. Mayor, and good evening to the Berkeley community. I just want to start out by thanking you, Mr. Mayor, and the City Council for standing shoulder to shoulder with staff throughout this entire pandemic. It has been intellectually and emotionally and physically demanding and exhausting of a lot of staff, starting back in January of 2020, all the way through the shutdown March, I think it was 17th. And, back at a time where we were learning what was going on, we're wiping down our grocery bags and figuring out that we need to have masks. And as a city, we've deployed hundreds of people through our EOC to combat this effort. And all the way up through today, where, back in the middle of December, we put a bunch of people on this vaccine effort. And that's carried through to today, where this week we're vaccinating TK through 2 teachers at BUSD to get folks back to school. So I want to really appreciate your support, the support of the City Council, with along with all of the staff that have been mobilized, and particularly Dr. Hernandez and Dr. Varhus, who have really been the 2 pillars of this activation. So really want to just thank all of you, and also appreciate the people of Berkeley, as you did, for working with us through this pandemic and making it as least impactful as it could be, knowing that it's been a significant impact on everybody's lives to do that. So operationally in the city, we continue to operate much of our services remotely. That was one of the big pivots that we did, was to get folks out of city buildings. Most of our city buildings are still all closed and services are being offered remotely. We are now starting to talk about a reopening plan for city services and city buildings. Just so you know, we're in the sort of early stages of talking about what that would look like, working with our labor groups, thinking through what it would take to do this safely and in a staged way that would allow folks to come back in. So that's something we're working on now. But very pleased really at the ability to continue to provide city services, whether those were emergency services through our fire department, or birth and death certificates through our vital stats folks who are in the buildings, to all of the the permitting and the planning, and things still continue to work in the city of Berkeley despite being remote. And actually, it'll be very interesting to see how, when we transition back to a more normal world, how we change and reconfigure based on the things we've learned about remote work. So really not much more to update on those regards, but here to help answer questions as needed.
Thank you so very much. So unless Dr. Varhus has anything that she would like to add, we can turn to questions.
I would just like to briefly say something about childcare and schools in particular. This week, last week, and again this week, we're really ramping up in terms of vaccination for our childcare workers. People have to understand that for the last year, they have been particularly hard hit. Families have not had care opportunities, as many care opportunities as needed for early childcare. And the childcare workers who traditionally are not high income earners, but just very good-hearted, well-meaning, and incredibly essential to the functioning of our community, have just really hung in there. So over the last couple of weeks, we have really made an additional push to help provide vaccinations for them so that we can really continue to have childcare options available in our community, which is just so critical for parents and families to be able to work and to rely on good care. And it also reduces the number of cases that happen in those settings, which is also obviously beneficial to all of us. We are getting a lot of questions or expectations about what our role is in terms of school reopening. Berkeley Unified School District is an independent jurisdiction. We have given them a lot of guidance and advice, and in the end, what they decide to do or what they need to do based on their particular circumstances is really in their hands. We do believe very firmly that schools can open safely with or without vaccine if proper guidelines are followed. And we believe that the district is doing everything they can to make that work. But again, and we have strengthened our support, as Mr. Budenhagen says, to begin to provide vaccines to teachers this week and in the coming weeks as an extra incentive to support school reopening. But we really just encourage and support schools to begin to open their doors more broadly to the community.
Thank you so very much. I know there were some questions around BUSD reopening that we'll get to, but as we are now under the state's school reopening plan, able to allow K-6 to open, and we have prioritized vaccinations, which I'm sure we'll talk about as well. The district does need to give us a complete safety plan for all their school sites in order for them to reopen, and that work and those conversations are ongoing. But district has announced a timeline for reopening, which was announced last week, and we're doing what we can to support them. But ultimately, the decision about when they reopen and the conditions under which they reopen for the safety of their students and their staff, those are things that will be developed by the Berkeley Unified School District, obviously with consultation with the City of Berkeley. So thank you. We received a number of questions, and I want to first direct the first set of questions to Mr. Budenhagen from the City Manager's Office. There's a question about enforcement, and this resident says, while this is not new, there are very many men and women I see in the Central Berkeley neighborhood with no masks. Can there be more signage or some sort of penalty? I know that this is a frequent question that we've had around sort of how we are notifying people about the requirements to wear face coverings and just sort of around the enforcement priorities around that.
Yeah, so thank you for that question. The things that we have done in that regard are, one, we put a lot of signs up throughout the city, particularly in our parks. We put thousands of signs actually reminding people to stay masked, to practice social distancing, et cetera. In our parks, we put out a lot of community messaging to that same effect through our website, through Twitter, through Facebook, et cetera. And then through a partnership with the mayor, put together signs, big mask on to move on signs which are really nice looking signs along some of our major corridors. So one of the things we feel like that the message is out there. And so if people are not wearing their masks, it's not because they don't know, it's because they're choosing not to do it. So that then makes it a more of an enforcement issue. And our enforcement has so far been focused somewhat, as Dr. Hernandez said, on some of the higher risk incidents where people are congregating in multiple people indoors, where there's more high risk of spread. We have, excuse me, we have had some parks monitors and code enforcement folks who have reminded people throughout the city that this is a policy and that they need to have a mask on when they're outside. But it's a challenging thing to enforce citywide. So when we hear about hotspots, that's where we, excuse me, that's where we focus more energy. So that would be bigger groups of people congregating inside. We've had some at retail food establishments, restaurants, et cetera, where we've cited restaurants. We've cited, as Dr. Hernandez said, some of the Greek houses, and have done more education and gentler reminders to people out in the community. So we'll continue to do that. If we see hotspots popping up that are of major concern, we do have the ability to have a more strict enforcement and actually to cite people and find them. So that is something we can do. So as we hear these complaints, we do have a group that meets every week that consists of somebody from our city attorney's office, the police department, Dr. Hernandez, Dr. Varhus, myself, and somebody else from the EOC, where we go through all of these. So we are looking at those, and we'll continue to monitor and crack down when appropriate.
Thank you so much. There were a few questions around homelessness during the pandemic. The first question was, can you provide a number of unsheltered people who've been tested for COVID and the protocol for reaching out to the unsheltered to administer the vaccine? And then a related question is around, what is the plan to vaccinate persons experiencing homelessness? I will note that there was an article in the San Francisco Chronicle this past weekend, which quoted Dr. Varhus around the city's going to be moving towards vaccinating persons experiencing homelessness. But I guess the first question was around individuals experiencing homelessness being tested. And I think that probably speaks more to sort of the outreach that Lifelong has done, and then in how we partner with social service providers to make them aware of testing opportunities and then the vaccination plan. And Mr. Budenhagen or Dr. Varhus, if you could provide some background information about testing and vaccinations for people experiencing homelessness.
Sure. People experiencing homelessness are an important part of our community. And since the beginning, we've been, very concerned about the potential threat of COVID to every single individual involved. And so, in addition to a variety of other efforts, such as, providing more food and hand washing stations and porta potties and, ensuring that shelters were safe, we have been also pursuing a both testing strategy. So some of the things that we've done, we have done some testing in partnership with Lifelong Medical through their street medicine teams that have also been expanded under COVID and hopefully long-term as well. We've also done some testing events, both in shelter and also through our Optum test site. We now have a bus, and we did a big mobile testing event just back in January, where we dedicated an entire half day to people experiencing homelessness and really worked with the service providers and the shelters to help bring people in. We're currently working on a model where we now have self-administered kits that are through a contract with the state, where we're going to be able to give those self-administered testing kits to our shelter community and allow for sort of longer term, more regular testing as opposed to a one-off to help keep the community safe. And we're not just talking about rapid tests, which have proven to be generally not so accurate when you're talking about asymptomatic people, but actual PCR tests that we will be able to enable our shelters and other to administer. So And I will also say that the rates of COVID among people experiencing homelessness have not been as high or as devastatingly high as we originally anticipated, which we're very grateful for. That doesn't mean that we don't need and want to continue to protect our unhoused community, but that has actually been good news for us for the most part. And then when we have had cases, we've been lucky enough to have the partnership with Alameda County, where they can come into the hotels for their isolation. And we've had the Safer Ground hotels as well for people that are at risk of more serious effects of COVID. So that's an area where I think that we've been well focused. And then the next move, I think you alluded to, was that we've reached out to the state to see if we could move forward on vaccinating people experiencing homelessness, because Berkeley is unique with a relatively small community with a higher number of homeless people. And we have heard back from the state that seems like a relevant and appropriate approach. And so in the next few weeks, we'll be embarking upon both doing an education and outreach campaign, because not everybody wants to be vaccinated and many people don't trust the system, but trying to do some education support and sort of a longer term offer. And in addition to people experiencing homelessness, as Dr. Hernandez said, we would also be looking to vaccinate the folks at Golden Gate Fields, who the state also is very aware have been an extremely vulnerable population.
Thank you so very much. To our next set of questions, which really are sort of related to the health order, as well as some very specific public health questions. There was a question around libraries, and specifically, why are libraries still closed when bookstores are open? Just noting that, allowing libraries to open, I will note that we've received several emails from parents with this very question. That will just enable kids and families to have not only access to books, but also just another opportunity for education and socialization. So I guess the question that's being posed is sort of asking around why are libraries still closed and when will they be allowed to reopen? And I don't know, Dr. Hernandez, if you have any information about the status of libraries under the health order.
Yes, libraries are currently allowed to open at 25% capacity. Just like as the person who asked the question about retail and bookstores, they're allowed to open at 25%, and so are libraries. So we'll have to get back to get more particulars to the individual about the status of the library opening here in the city. But overall, once we were allowed to go back to the purple tier and were released from the larger order from the state, 25% capacity for libraries indoors.
Thank you so very much. So the next question is about masking. And with various variants, in circulation in the state of California, there has been sort of guidance that people double mask. Certainly, it's something that I've done recently. So the question this resident's asking is, some sources, including the CDC, has set guidelines for double masking. Is this something that you would recommend? And how does one properly double mask?
So I think the goal of double masking is to do two things. One is to secure the fit so that you have a better fit, and two, that you have better increased filtration. So sometimes it's double masking, sometimes it's just improving the fit of the mask that you have. So my first thing is recommendation is to ensure that you have a good mask. And this should be, this is a recommendation whether you're dealing with variants or not. I definitely think you need to have, ensure that you have a good fit period, but definitely if you're going to be in a setting where there's less ability to physically distance. So that would be my recommendation. And these are the strategies. One is whatever mask you're wearing, whether it's one or two, is that you're ensuring that the fit is tight, especially where you're going to see some of your breath or any fluids escape, which would be over your nose, the bridge of your nose, and then also on the side of your face. And for all of us except for Dr. Varhus, we're all wearing glasses. And we know that sometimes that our breath escapes, and we can see it when we're wearing our glasses. So that's a reminder that we have to do a better job there, especially on the bridge of your nose. And there's some techniques. They're not so fashionable, which is using tape on your there. I know it's kind of harkens to the day of nerds, but that really does work. And also you can make sure that you have a mask or purchase those pliable metal bridges that you can put over your mask. So I use that to ensure that I have a good fit. So other things that you can do with the mask that you have besides the nose bridge is also on the side, as I mentioned, that's another area where there's a way for escaping, is to knot I should have brought my mask, but to knot the sides where your ear loops are, and just knot them close to the actual face covering or mask. And then that kind of tightens the edges. So that's one thing. The other thing to do is to increase the layers for filtration. One way is to make sure that you have a mask that has multiple layers. Another is to double mask. One other thing before I go to that in the layers is another way to do it is to use these mask fitters that you can put on the outside. I've never used them. I've seen them on the internet. CDC has a great infographic with some of those. I can't speak to that, but that is also another way to increase the fit. So when you look at layers, you can make sure that you have at least double, triple layers is best. The other way is to double mask. And there's different ways to do that. One is to wear a cloth mask over your regular like surgical mask, your paper mask. You can do that. That's a double masking. Or other is to make sure that you have multiple layers. You should not be wearing two surgical masks on top of the other. You should not be wearing any other covering over like a KN95 or an N95 that you have. So that is not effective. It's not recommended by the CDC. So that's the answer. That's a long answer to the question. I hope I explained it okay. Again, CDC, if you Google double masking CDC, there's a nice infographic, and it gives you the do's and the don'ts on there. And I'm sure it's way better and definitely way more descriptive than my my explanation, but pretty much double masking can work as long as you're not, if you use a cloth mask over a paper mask is the best way to do it if you're going to double mask that way.
Thank you very much. Extremely helpful information. I learned something I didn't know. So thank you. That's very helpful. And also the CDC has additional information on their website.
Yes.
A couple of questions around reopening. There was just sort of a general question around when will more outside areas open, such as chairs around outdoor pools. A related question was around allowing more people to, I guess, access pools. Right now, there are limitations on how many people can be within a lane at some of our municipal pools. So I don't know, Dr. Hannes, if you have any information. I know just generally, depending on where we are in the tiered status, that's going to dictate, and our case rate is going to dictate what's reopening and when it reopens.
Exactly. So in terms of the question about putting chairs around the pools, that's going to encourage gathering So that's not something that we're encouraging right now, especially because if it's a public pool, there's a likelihood that this is going to be with people outside of your household. So those spaces are still closed, and that's consistent with what the state's guidance. Essentially, we've moved to, as a city jurisdiction, moved to the restrictions based and the permissions based on what the state is allowing. So that's not something that's allowed at this point in terms of gathering and having that physical space available. And same thing with the lanes. I have to look to see if there's any specific guidance on that, but I could tell you that a lot of individuals preferred that we have single lanes. Got a lot of communication about that when we allowed two people in the lane. So this individual asked about that request, but we as a city got overwhelming request from the general public to have single lanes for swimmers, just single swimmer per lane. So that's something we can explore again, but at this point, we're leaving it as a single lane. And maybe as we move through the tiers, it can be a little bit more permissive.
Thank you so very much. There were several questions around the school district. I know that Dr. Varghese had touched on this in her initial comments, just specifically around, what role are we playing to provide guidance or provide clear guidelines on how the district will reopen, particularly around physical distancing. I know that we've gotten some questions from parents around, is the rule 6 feet, which I believe it is, but there's also reference in state guidance on 4 feet if 6 feet isn't feasible, and I think that's all going to depend on, the number of students and is the district going to be able to meet that 6 foot social distancing standard? So, Dr. Varghese or Dr. Hines, any information you'd like to share with the Berkeley community on those specific points?
Yeah, sure. I mean, I think the good news is that I think I worked in and with educators, including BUSD, for many years, and it's trying to address health issues it's very challenging. It's their educators. They're focused on giving our kids the best possible education, and there's some programs that address barriers to learning, but getting educated on COVID and implementing that's a big stretch. Fortunately, the school reopening guidelines really help understand what it is that is needed. So if you go through the reopening plan that the state requires, it asks questions like, how will you make sure that kids are, socially distanced and safe when they're eating lunch? So it walks you through steps to consider that are really fairly clear. And if you actually they're asking us this, how will we do that? And then you do that step, then it's actually quite possible to be able to get to a plan that really makes sense given your particular infrastructure or architecture in your buildings. We do have 9 private schools in Berkeley that are open and have really done well to submit really concrete plans. And we have been providing the district with a lot of guidance, and they've been very appreciative, and we've worked together on it. And so really it's just a question of doing that plan in a really good way to see what you have available. Now, there's lots of other things that influence reopening. I mean, there's fear of COVID. There's fear of, some families want kids, school open all the time. Others would prefer we wait. There's a lot of other things that I think are really more getting in the way around school reopening that are just humanity and who we are as people. And those things also have to get worked through. With regards to the feet guidance, the guidance is 6 feet apart. That's always the guidance. However, if there are situations and circumstances where that's particularly challenging, it will allow a restriction of that. The elementary schools in Berkeley are fairly large compared to the size of their pupil population. So there's actually quite a bit of flexibility that you could put in place. But again, we're supportive of the district's reopening. We are not involved in the politics around that, but we are doing the best we can to support that they're doing what's best for them and the kids and families of Berkeley.
Thank you so much. There were some questions around end of day lists. I know I've gotten a lot of questions from residents about this. Points of distribution typically have end of day lists of eligible individuals. If there's extra vaccine that they need to disperse, so they're not wasting a single dose of vaccine. And these couple of questions are: how does one get on the end of day list so they're notified if there is a surplus of doses at the end of the day? And I know that they're prioritizing people within the category of eligible individuals in the tiers. Is there general guidance provided to points of distribution about end of day lists, or is it up to each individual provider around how they do that?
So our primary focus is getting in-tier folks vaccinated. That is our number one priority in accordance with the state guidelines. And I guess that's the secondary. The primary thing is that in doing that, we use all of our vaccine. Like, we do not waste vaccine under no circumstances. We do at the vaccination sites that we have had, which our main one currently is the one in the West Buchanan parking lot. We do occasionally have leftover doses, but the city also has a list of in-tier people that may not have been able to get an appointment and or are really subject to the particular tiers, that we really try to do everything that we can to actually call people that are in tier, that are part of, that, for some reason are sort of next in line to get an appointment that we were not able to get an appointment for. We are really not like opening or paying attention to end of day doses for the broad community. This vaccine rollout is incredibly challenging. And at the end of the day, these questions come because we just don't have enough vaccine, and as supply increases, hopefully more and more people will get vaccinated, and that will make things a little bit easier. Right now, we're all, we're scrambling. We're trying to make something work. And so that's not a program that we're going to set up or, be able to sort of maintain.
If I could just tag a little bit onto that, as we've gotten further into the experience of distributing the vaccine, we've had fewer and fewer vaccines left over at the end of the day. So we're talking about small numbers at this point of vaccines left over. So it's not a big number. It's not a big group of people that are getting end of day lists at this point.
Okay, thank you so much. So would you advise that people sign up through the city's website for the vaccine notifications? Would that put them in a position, if they're within the tiered prioritization, that they could potentially be contacted if there's excess supply?
So I would do two things. I would definitely sign up for the city's notification, and especially if you're in tier. Currently, we are in sort of a subset of tier 1B, but we will be expanding soon to the full 1B. I would also encourage people to get on the My Turn website at the state of California, because we have this extremely privileged situation where we have this huge FEMA Cal OES site at the Coliseum. And we are hearing that people who are in tier, and in Alameda County, it is straight tier 1B, are getting appointments. So we would also encourage people to sign up for My Turn and to check their eligibility. And if they are eligible, to continue to check availability of appointments. I think that right now is one of the best options for getting vaccinated in our area.
Thank you so much. Okay, there was a question around vaccinating teachers, and I think the underlying sort of question or concerns being expressed is there was a situation, I believe it was last Sunday, where the school district had sent out an email to all employees with a link for people to sign up. And that was outside of the process that we were arranging with the district to set up appointments for teachers. And so I guess this would be a good opportunity to just clarify. We have worked out a system with the school district where we are going to be vaccinating their employees who are returning to the school site in a phased manner. And that schedule, the phasing in, was announced last week by the city and the school district.
And I just also do want to clarify that teachers are super important to our community. And I've had many wonderful teachers myself, and so have my kids in Berkeley Unified. And it's also school personnel that are incredibly important to the community. So it's the school secretaries, and it's the aides, and it's the janitors, and it's other people that are in the school community that make the school community, and all are super important, and they're also part of this system.
Absolutely. And I don't know if the Coliseum has opened up the eligibility of appointments for educators to get vaccinated. That's another option.
Yes.
Obviously, we're working with the districts to prioritize, I think it's TK through second, at least right now. But you can also sign up through myturn.ca.gov for an appointment at the Coliseum vaccination site as well. Okay. So question, how and when will I get my second dose of vaccine? There's no number or person to contact. Usually when you sign up, you're given a date a date and a time when your second dose is administered. Is anything you would advise about? I guess it depends on who's administering it. If it's a healthcare provider, you contact the healthcare provider. But if it's the city, is there anything you advise around, what residents should do to just follow up on scheduling the second dose?
Yes. Do you want me to talk about that, Lisa? So exactly as you said, Mayor, people should, obviously go through the provider who gave them their first dose. We did have some challenges with our second doses at the pod at Golden Gate Fields, the Buchanan parking lot pod. So for the first groups of people who got their first shots in the beginning of February, starting on February 4th, did not leave that site with a second appointment scheduled. And that happened for, probably about 2 weeks. So we've been in the process of working with Curative, who's administering those sites there, to contact everybody who had a first dose and make sure that they have an opportunity to sign up for their second dose. So everyone who got their first dose that week, starting on February 4th, should have received an email either from the Curative folks or from the city of Berkeley with a link to schedule their second dose. So that should have happened. And then for the next group of people that following week, they will get an email this week with the scheduling information for their second dose. So that should work out fine. If there are any issues, people should contact us through 311.
Okay, thank you so very much. There were a couple of questions around sort of the focus around vaccines after the 65 and up. And I know this was announced last week that we're going to move to sort of the next part of 1B, which are categories of essential workers. That includes, I think we're already vaccinating various essential workers like grocery workers and I think agricultural workers, food service workers, educators, childcare. So right now, I believe we're not just doing 65 and up, but we're doing other groups of eligible essential workers within 1B.
Yeah, so we continue to vaccinate anybody in phase 1A, healthcare workers primarily who may have waited or for some other reason not had a vaccine. We continue to rely on the Federal Pharmacy Partnership, which has actually turned out to be a fantastic resource for our skilled nursing facilities and long-term care facilities. So that continues, but we have moved into a more broad phase of 1B. So we, back in January, we transitioned to vaccinating people that were 75 years of age or older, because by far, that is the greatest risk to developing serious complications and potentially deaths from COVID. So we really started there and did a lot to saturate that. And then we moved on to people age 65 and over and are now including them. In addition, we are focusing on people who are providing in-person childcare and education services, and then also people who are attesting to that that's what they will do. So the TK through 2 teachers are saying, you know, we want to go back in the classroom. So the vaccine will help us feel better about that, and we want to go back. So we're vaccinating them. It also includes, we are also including grocery store workers, because grocery stores are also a place where we have seen cases. And so they are included as well. And then emergency services, we're not explicitly calling out, but over time, we have pretty much done most of our emergency services personnel. We do anticipate soon opening up just to the full 1B category. That will help us be more aligned with Alameda County and what's happening at the Coliseum. Following those essential worker groups, I believe, and Dr. Hernandez, correct me if I'm wrong, but I believe on, I think it's March 15th, the state is now saying that people aged 16 to 64 who have specific underlying health conditions will also be included as part of phase 1B. So we'll be able to move to have more support for those people who've really been sheltering out of real fear. What we're also hoping is that some of our hospital systems will actually help take that on, because they are obviously the most knowledgeable of what conditions people have, and we don't have that, but we shall see. Kaiser has this week received quite a quantity of vaccine, and will be picking up the pace. So hopefully they and Summit and will help to bring that up. Lifelong Medical, by the way, also is getting their own supply, both from the county as well as, I believe, and correct me if I'm wrong, Dr. Hernandez, I think the feds are giving them a certain amount of vaccine. So that is also especially good for our more vulnerable people. After that, the state is signaling that they're going to go to more of an age-based focus. But we don't know, because in this world of prioritizing people, it's an ever-changing thing. So right now we think they're going to be maybe moving on to more 50 to 64, but we actually don't really know. And at the end of the day, we just need more vaccine. And I know that the Biden administration has done a lot to try to increase our supply. And hopefully sometime by the spring, we'll really start to see more of a difference. I feel like even in the last week, there has been some movement, and I imagine in the next, 6 to 8 weeks, we'll see a lot more. So.
Thank you.
Can I just add?
Yes.
I'm sorry, Mayor. I just also want to add that one of the things that we need to really focus on, and one of our challenges, is getting into communities that don't have access to computers and cars, and providing vaccination clinics in neighborhoods where people will have walk-up access or other kinds of access. So we're currently involved with planning some mobile clinics and some neighborhood opportunities, and working with our community-based organizations and our churches to see where we might do sort of more, I would say, personalized local vaccination. And that is a huge priority for us. So now that we've been following all the state requirements about pushing vaccine out as fast as we can, we're really hoping to hone in on getting vaccine to people who need it most and who might not otherwise have access.
Thank you. Yeah, just the follow-up questions. As was reported, there were delays in the vaccine distribution due to the storm conditions in the Midwest. And just one resident was asking, given the delays due to weather impacts, when will we get back on schedule, and do we see availability increasing? So with respect to availability, I think it really depends on supply. But we are, the more vaccine we're able to get out there, the more that we're going to be able to access in the future.
So we were not that impacted. We were impacted heavily by the storm, but we had enough vaccine from the county and from other sources that we were actually able to pivot and focus on using up our Pfizer supply more quickly than we had planned, because it was the Moderna vaccine that was not shipped last week. We did get word from the state today that they are back on track and will be shipping all of our promised supply as well as what we're anticipating to get that this week. So we've been actually fortunate that it didn't totally, we were very close to having to cancel, more than 1,000 appointments at Golden Gate Fields, but we fortunately did not have to take that action. So we have been, we're very fortunate that we were able to get in some extra supply and continue to operate normally. We still don't have enough. With all of that, we still need more vaccine, and more will come as they develop it.
And I don't remember if we said this, but just to give you a sense of the scale, we're right now doing about 1,000 to 1,200 vaccinations a day.
Wow.
When we're open. So that's about where we're at.
Incredible. Just think, a few weeks ago, we launched the Golden Gate Field site, and we did starting with less than 400. So that's a significant increase. That's really great news. Okay. Lastly, there's a question around variants, and if there's any information about the spread of various more contagious variants in Berkeley. I know that there was various news reports regarding the impact, recent research on the impact of the California variant. I think many of us may have read that article this weekend. And I know that the British variant, I believe, there was confirmed cases in Berkeley. But I don't know if Dr. Haynes, anything else you've learned around which variants and the spread of various variants in the city of Berkeley?
So what we know, well, first I'll start with testing for the variants is very low. We don't have the capacity as a state to test as much as we need to. That's ramping up so we can do more testing. So some of the testing is done at different labs. Our state lab does some, and then certain labs in the region. Stanford lab is doing some testing. UCSF lab is doing it. Our own UC Berkeley IGI lab is doing some of the testing. So when we find the variant, we know that it's an underrepresentation of what variants are potentially circulating in our community. So right now we have 2 UK variants that were detected here in Berkeley, both affiliated with University of California, Berkeley. And again, that was due to the fact that they were tested at the UC facility and were able to be genotyped. And they're only doing a handful of the specimens they test that are testing positive for genotyping. So I think we'll get a better sense of how variants are circulating in our community as capacity builds up statewide. But so that's the evolving situation. What we know so far about these variants is that we don't have to do anything differently in terms of protecting ourselves for them. We have to continue to wear our face coverings. We have to wash our hands. We have to stay home when we're sick and avoid gatherings and crowded areas. So that's one thing. The other thing is that it does increase our urgency to vaccinate as many people as we can. So, being able to vaccinate 1,000 to 1,200 individuals a day is excellent. And we're seeing that capacity ramp up throughout the region and the state. So I think that's also going to be something that's going to be a strategy for controlling the emergence of these variants. So that's where we are. And I would say we have to keep doing what we're doing and hoping that we get as many people vaccinated as soon as possible as well.
Thank you so very much. Just some final questions. What is being done to ensure that those neighborhoods who've been impacted disproportionately by COVID-19 are getting information and access to vaccines? And Dr. Varghese talked about this just a few minutes ago in her comments, making sure that we can get information and access to vaccine in Black and Brown communities and communities that have been most disproportionately impacted by COVID-19. There was an article on Berkeley side, for example, just this past Friday about which zip codes have had the highest cases of COVID-19. is extremely important. It is a top priority of our city government. There's emerging programs that are starting at the statewide level through Cal OES to increase access to vaccine for people of color and individuals eligible just with an equity lens. And we'll be announcing a site in Berkeley soon this week that's specifically focused on providing vaccine appointments for those populations. I think in addition, we want to look at how we can partner with churches and community-based organizations that work with our Black and Brown communities to not only get information out about these opportunities, but also, and to dispel the fear of getting vaccinated, because there still is a great deal of fear in some individuals around whether it's safe to get vaccinated, as well as to potentially look at creating some pop-up vaccination sites. So this is definitely something we're working on very actively, and trying to ensure that we can increase the availability of vaccine from an equity lens is definitely a top priority of, I think, everyone here. There was a question around what policies are being considered to address additional homelessness that's been created as a result of COVID-19 impacts. Well, this has certainly been an area we've been working very actively on since the beginning of the shelter-in-place order. I think the day the shelter-in-place went into effect last March, we adopted an eviction moratorium for residential and commercial evictions. And we've strengthened those regulations. We also launched a housing retention program that provides emergency housing assistance for people that are facing housing insecurity. And we've been able to help, I believe it's roughly 400 households since we launched that program during the pandemic. And we have also increased funding in that program, thanks to the federal government and also through city funds, so we can help more households who've been impacted by the pandemic. And so if you are somebody who lives in the city of Berkeley, you're a residential tenant and you have significant rent debt, and I will just note you can't be evicted under the moratorium, but if you don't pay your rent, and I think there's certain, the state eviction moratorium requires you to pay about 25% of your rent debt. If you are facing housing insecurity and unable to pay your rent, we do encourage you to reach out to the Eviction Defense Center, who is administering our housing retention program. There is a wait list currently, but we encourage you to contact the Eviction Defense Center at 510-452-4541. Once again, 510-452-4541, and leave a message, state your name, your phone number, that you're a Berkeley resident seeking assistance, and a staff member will be in touch with you to determine your eligibility. And so once again, we've increased funding. The state of California has also provided funding to Alameda County to support the Eviction Defense Center and other nonprofits that provide legal representation and housing assistance for people who are facing housing insecurity. So there will hopefully also be resources soon through the County of Alameda to help eligible Berkeley residents and other Alameda County residents who are facing housing insecurity. We also know that recently the state of California passed Senate Bill 91, which extended the eviction moratorium and also created a new program where landlords who agree not to evict their tenants will be reimbursed. I think it's roughly 85% of the rent debt that is accrued, and tenants have to pay the remaining portion. So that program is also starting to roll out, and the legislature this summer will have to extend that moratorium again. And so there'll certainly be discussions around how we can expand and extend those protections for people that are facing housing insecurity due to COVID-19. And then there's the issue of what happens after the local emergency is over, and how we're going to be able to support households who may owe thousands and thousands of dollars, and that's going to continue to be a priority of us, and certainly a priority of the state government as well. Last question, what is Berkeley and the county doing to lobby Sacramento and DC on the budget to address COVID impacts at the local level? Well, there's been a great deal of work that's been happening, not just in Washington, but also in Sacramento. Several CARES Act bills have passed, and there's President Biden's proposed CARES Act legislation is currently pending in Congress. That would provide, at least presently, roughly $63 million to the city of Berkeley. That would be available very soon to support our COVID response and address the budget impacts of the COVID pandemic. And so we call on all Berkeley residents to contact Congress to express support for this critical legislation so that Berkeley and cities throughout the entire country can have the resources to not just to fight this pandemic, but to help address the significant budget impacts it's created on our local government budgets. And just, I think today, I read today that Sacramento the legislature approved additional payments for individuals who have, faced economic insecurity. I think $600 payments for low-income Californians were just approved by the legislature, and that's on its way to the governor as part of a much broader package of COVID relief that the state of California is putting forward. So we work very closely with our state senator and state assembly member to advocate for Berkeley's needs. And certainly as a mayor, I'm involved in advocacy on the federal level with other mayors around federal resources to support cities like Berkeley. So those are all the questions that we received today. And in closing, I just want to thank our city leaders for joining us this evening. I know our community really appreciates this opportunity to get critical information about our COVID response and to get specific questions answered. And I think this is very unique for a local government to do this, to have this direct opportunity to engage with our community around their questions, their concerns, and their priorities. And just lastly, just want to thank you for your incredible service to our community. So I'll want to turn over to Dr. Hernandez if there's anything you'd like to add in closing tonight.
No, just I do also enjoy having the opportunity to communicate on this level, this forum, with the community and answering questions as much as I can, and just thanking the community and asking the community to continue doing what they're doing overall. The response and the support from the community has been excellent, and that's why we have made it through this winter surge, and hopefully we'll be getting back down to those levels pre-winter surge soon, and more and more individuals will be getting vaccinated. So I think we're going in the right direction, and we just need to continue to do the things that we've been doing for the last year. I know it's a long time, but I'm hopeful that we will be getting out of this pandemic in the coming months, and things won't be completely back to normal soon, but we're heading definitely in the right direction. And I just want to thank the community and thank you, Mr. Mayor, for your support and leadership.
Thank you so much. Dr. Barhus, anything you'd like to share with the Berkeley community before we close?
No, I just want to thank you, Mayor, for giving us the opportunity to share. We're moving at such a fast pace all the time, every day, that it's not always easy to share with the community all that we're doing, and also to answer questions that people have the right to have answers to. So you're providing these town halls really is a really helpful forum, and it is really it really does help us to communicate with folks. So thank you again for hosting, and I'm happy to be here as always.
Thank you. Thank you so much. And Mr. Budenhagen, anything you'd like to share with the Berkeley community before we close?
Just to thank you for the opportunity to be with you tonight. It's been a pleasure. Thank you also for all the partnership from everybody in this whole crazy journey. We'll continue at it. I really do look forward to our next push here to really figure out how to vaccinate and support people who are having a hard time getting to the vaccine. How do we bring the vaccine to them? So really, how do we help get our Black and brown and low income disconnected communities connected into this vaccine? Very excited about that big push that we're going to make. Thank you for your support on that, Mr. Mayor, and it's great to be with you tonight.
Thank you so much for joining us tonight. Please stay tuned for our next town hall, which will be 2 weeks from now, and an opportunity to submit questions. And in closing, we encourage you all to please be safe and healthy and practice physical distancing. Remember to wash your hands. Remember to wear a face covering when you're outside, and know that there's light at the end of the tunnel. So thank you all so much, and please be safe.